GP wellbeing was a particular issue even before COVID began, and then GPs have faced unprecedented difficulties during the pandemic. So our research has kind of synthesised the evidence base on that to try and highlight where future research might be needed and where policy is needed to try and support the GP workforce. Anxiety and depression particularly varied quite substantially across different settings. And for example, like doctors in Singapore described that they felt kind of more supported in terms of like national preparedness. And that is something that doctors in a UK study felt they described feeling quite let down by the kind of decision making and systems in the UK. So there were 7 studies which reported on gender differences, and all of those suggested that women GPs had struggled more during the pandemic. There's been research looking at that across the board of, society has shown that women during the pandemic have struggled more because of the kind of societal expectations on them. So I think that was certainly a factor that we found in our own primary research. And another one is age. Was quite interesting, the kind of differential effect of age on outcomes. So older GPs were more likely to report more stress and more burnout. Younger GPs, particularly those that are kind of early out of training, really felt isolated during the pandemic, and that kind of lack of support network, being in practice with senior colleagues, is perhaps one of the explanatory factors. It's so important because it doesn't just affect doctors and their well-being, but it's also how, the infrastructure of the health system is based on doctors being available and doctors being well.